Assalamu alaikum and good afternoon from Malaysia. Thank you for joining this 35th MedEd webinar on emotional intelligence and its application in medical education. This session would become more meaningful if you relate its content with your personal and professional experience while we are going through this webinar. Let us look at the learning outcomes first. After attending this session, the participants will be able to explain the concept of multiple intelligences and emotional intelligence, discuss the components of emotional intelligence, discuss the role of emotional intelligence in medical education, summarize the inclusion of emotional intelligence in the training program for undergraduate medical students around the globe, and explain how to introduce emotional intelligence in the curriculum of undergraduate medical students. So inshallah, by the end of this session, we will achieve these 5 learning outcomes. Let us start with a very simple question. What is intelligence? When we hear the word intelligence, the concept of IQ testing immediately comes to our mind. However, we all know that IQ is not equivalent to intelligence. Intelligence is often defined as our intellectual potential, something we are born with, something that can be measured, and a capacity that is difficult to change. The predominant word here is intellectual potential. Intelligence is a multifaceted concept that generally refers to the ability to learn, ability to understand, and ability to apply knowledge and skills. It encompasses various cognitive processes, including problem solving, the capacity to find solutions to complex and challenging issues, reasoning, the ability to think logically and make sense of things, learning, the capability to acquire new knowledge or skills through experience, study, or teaching, adaptability, the skill to adjust to new situations and environments, and creativity, the talent to generate new ideas and concepts. So these 5 cognitive processes make the basis of intelligence. And whenever we want to assess or measure intelligence, we should be using these 5 cognitive processes. Intelligence can be measured in different ways, such as through IQ tests, emotional intelligence assessment, and other cognitive evaluations. So that is our understanding of intelligence. Now let us move to another very interesting concept of multiple intelligences. This theory suggests that traditional psychometric views of intelligence are too limited, means our understanding and the ways we assess and the tools we use to assess intelligence are too limited. Howard Gardner first outlined this theory in his 1983 book, Frames of Mind, The Theory of Multiple Intelligences, where he suggested that all people have different kinds of intelligence. Means each one of us has one or other type of intelligence. Gardner proposed that there are 8 intelligences. He also suggested a 9th one, but most of the time we talk about 8 different kinds of intelligences, which are like spatial, linguistic, intrapersonal, interpersonal, logical, mathematical, musical, bodily, kinesthetic, naturalist. Most of us are familiar with logical, mathematical type of intelligence. I will talk about few of these intelligences in detail so that we get a clear concept of these multiple intelligences. The first one, visual spatial intelligence. The individuals who possess this intelligence, they are good at visualizing things. They are often good with directions as well as maps, charts, videos, and pictures. And their strength is at visual and spatial judgment. Their characteristics, they read and write for enjoyment. They are good at putting puzzles together. They interpret pictures, graphs, and charts well. They enjoy drawing, painting, and visual arts and recognize patterns easily. We can also use these characteristics to train these people effectively. The potential career choices for these people include architect, artist, and engineers. The second intelligence, logical mathematical intelligence, this is the one which most of us are familiar with. And these are the individuals who are good at reasoning, recognizing patterns, and logically analyzing problems. They tend to think conceptually about numbers, relationships, and patterns. The logical approach is their main area. And their strength is analyzing problems logically and mathematical operations. Their characteristic, they have excellent problem-solving skills. They enjoy thinking about abstract ideas. They like conducting scientific experiments and can solve complex computations. The career choices for these people include scientists, mathematicians, computer programmer, engineer, and accountants. The next intelligence which I'm going to talk about is bodily kinesthetic intelligence. These individuals are good at body movements, performing actions, and physical control. They tend to have excellent hand-eye coordination and dexterity. And their strength is physical movements and motor control over these movements. Their characteristics include that they are skilled at dancing and sports. They enjoy creating things with hands. They have excellent physical coordination, and they remember by doing rather than hearing or seeing. The career choices for these people include craftsperson, dancers, builders, surgeons, and actors. Now, this is our concept, our understanding of multiple intelligences. So after talking about intelligence and understanding what multiple intelligences are, now we are going to address our third aspect, which is social intelligence. Howard Gardner's original theory of multiple intelligences did not include social intelligence as a distinct category. However, two of Gardner's identified intelligences, that is interpersonal intelligence and intrapersonal intelligence, if we combine those two, and those two would collectively cover aspects of what we know or often think of a social intelligence. So these two intelligences, which is intrapersonal and interprofessional, combined together make the basis of social intelligence. Social intelligence represents two intelligences described by Gardner, combined. First, the interpersonal intelligence. This is the ability to understand and interact effectively with others. Understand and interact effectively with others. And it includes empathy, effective communication, and social awareness. And these are core elements of social intelligence, that is the empathy, effective communication, and social awareness. The other intelligence, which is a component of social intelligence, is intrapersonal intelligence. This involves self-awareness, understanding one's own emotions, and managing one's own behavior, which also plays a role in social intelligence by helping individuals regulate their actions and responses in social situations. This is an important part of social intelligence, the ability to regulate our actions and responses in different situations and environments, and appropriate responses to behaviors and emotions. Social intelligence is the ability to effectively understand, navigate, and manage social relationships and environments. It encompasses several skills that help people interact harmoniously with others, and these skills include empathy, which is the capacity to understand and share the feelings of others, recognizing their emotions and perspective. Social awareness, being attuned to social cues, group dynamics, and social rules or expectations in different settings. Effective communication, the ability to clearly convey information, emotions, and ideas, both verbally and non-verbally. Conflict resolution, possessing skills for managing disagreements constructively, finding ways to resolve conflicts and maintaining relationships, and relationship management, that is building and maintaining positive relationships, including knowing how to support, motivate, and inspire others. So there are 5 basic attributes for social intelligence, which is empathy, social awareness, effective communication, conflict resolution, and relationship management. Social intelligence enables people to adapt their behavior to different social situations, making them more adept at creating connections, building rapport, and fostering collaboration. Therefore, high social intelligence often leads to better professional and personal relationships and can enhance leadership abilities. Therefore, we can realize that how important the social intelligence and attributes of social intelligence are important in our personal and professional lives. Now, after going through three aspects of what is intelligence, what is the concept of multiple intelligences, and what makes social intelligence, we come to our most important component of today's session is the emotional intelligence. This cartoon can clearly convey the message that how emotional intelligence can make big difference in our lives. Emotional intelligence is a type of social intelligence that involves monitoring, discriminating between, and using emotions to guide thinking and actions. That is, again, monitoring, discriminating between, and using emotions to guide thinking and actions. So how we use our emotions, how do we control our emotions so that we have a proper thinking and proper actions and proper responses. Emotional intelligence is related to interpersonal and communication skills. And it is important in the training and assessment of medical undergraduate students. Emotional intelligence is based on the premise that emotions convey information and can be perceived in different ways by different people. I think all of us are very, very aware of this the fact that sometimes emotions can be misinterpreted. These perceptions then impact the ability of health professionals to adapt their performance within a variety of educational contexts and clinical situations. To have proper responses and proper actions, we must understand the emotions properly. Misinterpretation of emotions can lead to catastrophes. This is another very interesting aspect of emotional intelligence, that is achieving desirable responses. Emotional intelligence can affect performance, promote self-regulation, and cultivate self-assessment, thus fostering motivation, enhancing empathy, and improving social skills of health professionals. The important words here that it can affect our performance, it can promote self-regulations, and it can cultivate self-assessment if we have proper training, proper knowledge, and proper skills of emotional intelligence that can affect very strongly our professional lives. These enhanced social skills can assist in developing desirable responses in others. This is important and interesting aspect, that with proper utilization of emotional intelligence, we can achieve desirable responses from others, such as getting collaboration, improving communication, enhancing leadership skills, and conflict management. Emotional intelligence helps to develop coping mechanisms that promote well-being and social adaptability, and other very important aspect of ability to cope with the situations, and thus that would help in well-being and social adaptability. Thus, a higher level of emotional intelligence results in better cognitive performance, often secondary to the ability to ward off frustrations, persist on the task, enhance self-efficacy and motivation, and therefore, emotional intelligence has been found to have a positive correlation with clinical performance and clinical reasoning because it helps in dealing with frustrations, dealing with the burn, uh, burnout of both students and the staff, and thus improves motivation. Students we admit to medical school is usually on the basis of their academic achievement. This is one aspect I'm going to talk about, the interpersonal relationship, how it affects our profession. The first thing is that students we admit to medical school is purely based on their academic achievement. The second point, professionally, however, their success rate is variable and may depend on their interpersonal relationships. We all know that a good performing student may not always be a good physician. Their results in medical schools are not necessarily related with their ability to become a better physician because their ability to handle interpersonal relationships. Emotional intelligence is thought to be significant in achieving good interpersonal relationships and success in life and career, and therefore, emotional intelligence development and measurement should be included in the formal medical curriculum to improve interpersonal relationships, teamwork, and health care outcome. What it means is just the academic grades or academic achievements are not enough to be a good physician. We need to have good interpersonal relationships to become a better physician, and emotional intelligence can give us that skill, and therefore we should include this in training of our medical students. There is a strong consensus in the literature that emotional intelligence is a developable and therefore teachable skill set. This is an important information, important point, that emotional intelligence can be taught, can be learned, and can be included in the curriculum of undergraduate medical students. So in conclusion, since high emotional intelligence has been shown to have a positive correlation with academic performance and better mental well-being of students, and on top of that, since it has been identified as a trainable trait, all effort should be made to enhance emotional intelligence of medical students during their undergraduate training program. Now, let's look at the point that how we can enhance emotional intelligence in medical students, being convinced that emotional intelligence is a very, very important aspect of training and to become a better physician. Before we talk about how to enhance emotional intelligence, let us look at the operational definition of emotional intelligence. Emotional intelligence is the ability to understand and manage both your own emotions and emotion of people around you. Your own emotions and the emotions of people around you. Emotional intelligence is the ability to perceive, understand, process, and use emotional information about oneself or others to enhance thinking and actions. It is important to understand this operational definition so that we can incorporate these areas of emotional intelligence in our undergraduate medical programs. There are three major essential steps of emotional intelligence. Number one, the appraisal of emotions in self and others. Number two, the regulation of emotions in self and others. And number three, the utilization of emotions. Let me explain these points briefly, one by one. Appraisal encompasses the skills to perceive and correctly identify particular emotions expressed either verbally or non-verbally, and to provide socially adaptive responses to other emotions, that is the empathy. So important thing is to correctly identify particular emotion and to provide appropriate response to that emotion. Second, regulation refers to moods, that is the capacity to lift one's own mood and those of others. And of course, it is a very, very positive influence in many circumstances. The third essential step is utilization, which relates to employing emotions to achieve goals. For example, using controlled aggression in sporting endeavors. Apart from these three essential components or steps, Goleman's emotional intelligence theory comprises 5 core components: self-awareness, self-regulation, motivation, empathy, and effective communication are social skills. We need to understand all these 5 core components in a bit more detail so that we become clear enough to include emotional intelligence in our undergraduate medical curricula. Here is the brief description of these 5 components of emotional intelligence: self-awareness, self-regulation, internal or intrinsic motivation, empathy, and social skills. Just look at the second, that is the social self-regulation, the ability to control impulses and moods and to think before acting. So that can tell us how important it is to have knowledge and skill about emotional intelligence. Self-awareness is the ability to recognize and understand one's own emotions and being aware of the effects of one's actions, moods, and emotions on others. People who possess self-awareness have a good sense of humor. They are confident in themselves and their abilities, and they are aware of how other people perceive them. The benefits of self-awareness include better relationships, calmer mood, clarity of thought, improved decision-making, high self-esteem, ability to change habits, better self-control, empathy towards others, and a better perspective on life. How to improve self-awareness? Ask for constructive and honest feedback. Keep a journal. Reflect on your experiences. Pay attention to your thoughts and emotions. Pursue your passions. Practice mindfulness. Set goals. Use positive self-talk. Work on building and growth mindset, and learn new skills. Second element, the self-regulation. It means waiting for the right time and place to express emotions. Self-regulation is all about expressing your emotions appropriately. Those who are skilled in self-regulation tend to be flexible and adapt well to the change. They are also good at managing conflict and diffusing tense or difficult situations. Very important attributes are useful and fruitful practical life and leadership. Motivation. People who are emotionally intelligent are motivated by things beyond external rewards like fame, money, recognition, and acclaim. People who are emotionally intelligent have a passion to fulfill their own inner needs and goals. So these are the people who have their own goals and inner needs, and they are not really running after external rewards. Empathy is the ability to understand other people's feelings and see things from their point of view. Such an important attribute for a physician to handle their patients. Empathy involves being able to recognize another person's emotional states and understand why they are experiencing them. Again, a very important aspect of medical or surgical practice. Social skills. Emotional intelligence involves understanding one's own emotions and those of others, and the ability to put this information to work in daily interactions and communications. Being able to interact well with others is an important emotional intelligence skill. Social skills such as active listening, verbal and non-verbal communication, and persuasiveness allows to build meaningful relationship with others and develop a stronger understanding of them and oneself. Decision making. It is the capacity to identify and make responsible choices. Good decision-making involves taking actions while understanding and accepting the outcomes. Just think of different options for treatment and to choose the most appropriate. And once person has made a mind, has made a choice, then they should be able to understand, accept the outcomes. Now let's move on to the emotional intelligence and medical education aspect of this presentation. There exists a recent shift towards recognition of the importance of emotional intelligence within medical education. The importance of emotional intelligence in medical education is increasingly being recognized, particularly as an attribute in fostering the patient-doctor relationship. This is again a very, very important aspect of emotional intelligence and its role in patient-doctor relationship. One facet of this relationship can be conceptualized as an interaction whereby a doctor allows medical consultations to be patient-led. If a doctor is responding appropriately to patient's emotions, then of course the medical consultation would become a patient-led consultation. This allows for patient autonomy, a concept which may lead to more effective treatment adherence and better outcomes for patients. We know that throughout medical education research, the patient-centered approach has been identified as a central value in medical communication. The General Medical Council, in its Tomorrow's Doctors document, sets out effective communication with patients and colleagues as a key outcome for undergraduate students. Interpersonal communication skills have been identified as one of the 6 areas of professional competence for doctors by Accreditation Council for Graduate Medical Education in the USA, with emotional intelligence included as an assessment item under moral or effective dimension. It is not only the UK and USA, but also in other developed countries like Canada and Australia. The importance of effective communication for practicing physicians has been identified in many national codes such as CanMed in Canada and the Australian Medical Council. Recently, literature has begun to assess the importance of developing emotional intelligence in medical students prior to their graduation. It has been indicated that training in communication skills leads to decrease in anxiety by students regarding communication with patients, although anxiety still remains when faced with patients who are crying or in emotional distress. This point can clearly illustrate how important it is to train our graduates in emotional intelligence so they can handle the situations and treat their patients well in very distressful situations when patients or their relatives start crying or they are really distressed. And so it is very important for the doctor to be capable of handle such situations. It is therefore important to consider how communication skill training, in particular the role of emotional intelligence and empathy training, is translated and applied by medical students. There is a large body of literature pertaining to interventions to improve emotional intelligence in medical students. So a number of interventions have been identified, have been recommended to improve emotional intelligence in medical students. However, it has been realized that it is not an easy task. It is a difficult task to achieve in undergraduate medical education, but at the same time, very important and essential training area. Emotional intelligence is important for medical students' own well-being and their clinical and professional performance. The impact of emotional intelligence on increasing self-awareness and improving students' level of resilience, influence, adaptability, and decisiveness is paramount in their well-being as well as their performance as potential clinical leaders. I think this is very important point, that emotional intelligence is important for medical students, their own well-being, as well as their clinical and professional performance. And emotional intelligence helps by increasing the levels of resilience, influence, adaptability, and decisiveness so that students can deal with and cope with stressful conditions and maintain their well-being, and it also improves their clinical and professional performance. If these aspects can be improved, then there are clear positive implications not only for the students themselves, but for the patient and the clinical environment. Now let us look at examples of emotional intelligence in medical education around the globe. In Cardiff University, UK, they have implemented a program focused on building emotional intelligence among medical trainees. This program aimed to develop resilience and improve the overall well-being of students. As a result, the students reported better stress management and enhanced interpersonal skills, which are crucial for their future roles as physicians. The University of California, San Francisco introduced a curriculum that integrates emotional intelligence training into medical education. This initiative included workshops on empathy, communication, and stress management. Students who participated in the program demonstrated improved patient interactions and a greater ability to handle the emotional demands of medical practice. Harvard Medical School has incorporated emotional intelligence training into its curriculum through courses on patient communication and empathy. These courses have helped students develop better bedside manners and improve patient satisfaction. Graduates from this program are often noted for their compassionate approach to patient care. The Mayo Clinic has a strong focus on emotional intelligence in its medical education program. They offer mentorship and support systems that help students navigate the emotional challenges of medical training. This approach has led to a more supportive learning environment and a better mental health outcomes for students themselves. The University of Sydney has integrated emotional intelligence into its medical training by emphasizing reflective practice and mindfulness. Students are encouraged to reflect on their experiences and develop self-awareness. And this has resulted in improved emotional regulation and a more empathetic approach to patient care. With these examples in mind, let us look at why and how to introduce emotional intelligence in medical curriculum of our institutions. First, why to introduce emotional intelligence in medical curriculum. There is increasing research evidence that doctors' emotional intelligence influences their ability to deliver safe and compassionate health care. A particularly pertinent issue in the current healthcare climate. The ability to deliver safe and compassionate health care, definitely a very pertinent issue. Emotional intelligence was significantly and negatively correlated with burnout among medical students. Very, very important aspect. As it may play a role in helping medical students cope with stress and prevent burnout, training in emotional intelligence is essential for their future professional development. How to introduce emotional intelligence in medical curriculum? An emotional intelligence resilience curriculum offered as an elective to second-year medical student was well received by students. Teaching emotional intelligence skill and resilience strategies in the preclinical setting might be an opportune time for this type of educational intervention. And this is important that we train or at least start training our students in emotional intelligence before they are fully involved in clinical learning and work. Students must see emotional intelligence as an integral part of their existing program and not as something to be developed in a separate environment. We really do not need to have an additional course to cover emotional intelligence. Students must be given opportunities to practice these skills in context similar to the ones they will be facing outside the classroom. If we train them in the preclinical years, so they would have an opportunity to practice these skills during their clinical years. Emotional intelligence training should be interdisciplinary and holistic as an opportunity for education and leadership development through practical applied preparation. So interdisciplinary approach and holistic approach is the way to go. What should be the content for training of health professionals in emotional intelligence? Some of the topics include time management, communication skills, teamwork, empathy, reflection, critical thinking, stress management, resilience strategies, and conflict prevention and resolution. Methods of implementation of emotional intelligence in undergraduate medical education can include electives, mentoring, and sessions like team-based learning. So the concluding remarks, training in and application of emotional intelligence in medical schools will help both the teachers and students in coping with the stress and prevent burnout, result in less dropouts from medical schools, lead to less dropouts from medical profession, as we know that some graduates, they leave the profession during the house job period, enhance leadership abilities as high social intelligence often leads to better professional and personal relationships. And we know that as a physician, at whatever level we are, we have a leadership role as well. Emotional intelligence can help undergraduate medical students in many ways, including fostering relationships. Emotional intelligence aids students in forming strong, healthy connections with their peers, patients, and their caregivers, a very, very important aspect. Enhancing academic success, students with higher emotional intelligence tend to achieve better academic results. Promoting mental well-being, higher emotional intelligence is linked to improved mental health among students. Cultivating professionalism, emotional intelligence is crucial for professionalism and is tied to essential competencies for physicians. Boosting leadership skills, greater emotional intelligence is associated with effective leadership, leading to increased productivity and efficiency. Now, here are a few questions which one of our participants has raised. First, how to teach emotional intelligence during first year of MBBS or BDS? I think I have answered that questions in my talk very clearly. Second, does emotional intelligence will improve performances of repeat or failed students. Certainly, it will help coping with stress, and that would in turn help these students to perform better in their exam. Third question, do we have to include psychologists in our teachers list for these students? I think not necessary. Regular medical teachers, especially the clinicians, can teach by sharing their personal experiences and create interest among students in emotional intelligence. I think that is my last slide, and that concludes my presentation. And I would be happy to answer your questions. But before I address your questions, I have an appeal to make. This is about charity drive. May I propose to each participant to donate $1 or equivalent amount in your local currency to any deserving individual in your neighborhood or any public welfare organization in your community after attending every webinar conducted from this platform. I thank for your attention and your support, and I will be happy to answer any question if you have about this topic. Thank you very much. Any questions, please?
Yes, I am Dr. Khalik Ji from Lahore. I want to ask a question. Thank you very much, Dr. Shira, for the excellent presentation by you on emotional intelligence. Just I want to ask a question. In the beginning of the lecture, you mentioned the people, there are types of intelligence, visual, spatial.
Right.
My question is, these people who have increased are very good visual, spatial intelligence, they are generally deficient in auditory sequential skills, leading to complex set of problems. Is it true, or what sort of percentage these people have deficient auditory sequential problems? This is my concern.
Right. Okay, sir. The question was that the theory of multiple intelligences says that there are 8 different type of intelligences, and all of us would have some kind of intelligence. That does not mean that if we have one kind of intelligence, we would not have intelligence in other areas, may not be on the same level, but at different levels. So we cannot say that if one person has intelligence in one area, they would be not familiar or would not have intelligence in other areas. So I don't think we can generalize. On the other aspect that you were mentioning is, I think, relates to the learning styles. So again, the students would have a prominent learning style in predominant learning styles, but they would have other learning styles as well. So I don't think we can generalize that statement. It may be on 1 or 2 individuals, but cannot be generalized. I hope I answered your question.
Not generalized, but do you think it is some people may have some auditory deficiencies? They are good at spatial, like the kids. These abilities they do develop after the age of 2, because being pediatrician, I can quote the developmental or brain development of the children, right from they are block seeing, they are block making, they are copying pictures. These sort of so in later age the people may have some auditory deficiencies. This is my question.
That's what I'm saying, sir, that some individual may have, but we can make it as a statement, generalized statement that everybody would have that.
Okay, thank you very much. Thank you very much.
Okay, Dr. Subbalakshmi, please.
Hello, sir. I'm from Subbalakshmi from India, sir. A wonderful presentation. My question was, what about assessment of emotional intelligence, sir? You said it's a learned skill, and I mean, it is a very elaborate presentation. But is there some way that we can assess these skills?
Yeah,
Objectively.
I think that's very important question. Yes, because these attributes would be. Uh, can everybody mute yourself, please? Because it's disturbing everybody else. Yes, the assessment of these emotional intelligence attributes would be usually seen in clinical areas. That how, for example, emotional intelligence, and we can have a real situation, or we can have a simulated situation, or we can have a role play, that how a graduate or a student deals with emotional distress, for example, in a patient. Or in other words, that if you are breaking a bad news, so how good you are at dealing with the distress of the patient, and whether you are able to perceive the emotions of the patient, and whether you have enough empathy to handle that situation. So these are the one point which you have raised rightly, that this is not something which we can assess theoretically. It has to be practical situations, and that for us would be mainly clinical situations. As I said, it may be real patient, or maybe simulated patient, or a role play, and in that way we can assess this.
Thank you, sir. Thank you so much.
Assalamu alaikum, sir.
Walaikum assalam.
Sir, I'm Dr. Ishtiaq from Pakistan. You are stressing a very good presentation and very excellent, important topic on a very important issue. So, sir, I'm just adding one thing that you mentioned in a clinical situation, that always it relates to with patients and clinician. But, sir, our basic sciences teacher who are dealing most of the time with students, so they need the intelligence skills to manage those. To manage them.
Absolutely right, sir. If we, let's say, if training in emotional intelligence is included in our curriculum, so our teachers come from the same areas, right? If now we are teachers, but if we are trained in emotional intelligence during our undergraduate years or postgraduate years, then we would be able to handle these situations as a teachers. We will be able to handle these situations better in preclinical years as well as clinical years. And as you might remember that there was one statement that emotional intelligence helps to reduce the burnout, not only in students but teachers as well. If we are able to handle this situation among our students in a better way, that would be helpful both for students and teachers.
Sir, one more comment, sir.
Yep. Yes, please.
Sir, you are mentioning about the curriculum of emotional intelligence. So, if we think in our own perspective of Islam, so our Prophet has demonstrated excellent emotional intelligence skills in different era of his life. Like one hadith, that if you listen a joke from a person and you already listen it, so again you should show the same feeling that as if you have not listened it before. And similarly, other occasion, like he was promoting to do mashwara when there is some problems. If we also include the life of our prophet and example of that era in this curriculum, so that will be better from our perspective.
Yeah, I mean, there's no denying to that. But if we it's not necessary to use religion as one reason to include it in the curriculum, because yes, it might be true in your setup, but it may not be true in other setup. But if these are sort of general rules these are fundamental truths, so that can be included, not necessarily under the heading of religion. And that might be more acceptable.
Okay, thank you, sir.
Panel people. Right, okay.
Assalamu alaikum, sir. I have a question. I'm
Yes,
Dr.
please.
Marokh from Pakistan.
Yes,
First of all, thank you. It was a wonderful presentation. And I was interested because I conducted a workshop on emotional intelligence training program a few months back.
good.
My question is on the assessment of the emotional intelligence.
Right.
As if I talk about my workshop, I used pre-validated emotional intelligence tool to understand the pre-workshop scoring of the participants, and then after giving them training of 1 month, and then again handing over the questionnaires to them to see if the 1 month training have improved their emotional intelligence or not. As you said earlier, that we can use simulated situations as well. So my question is that is validated tools is a reliable and significant tool to measure emotional intelligence theoretically, or the simulated situations can best measure the emotional intelligence scenarios?
All right, thank you very much.
Thank you.
So there are a number of tools available to assess our own emotional intelligence, and one of the tool I had shared in the groups as well, and some people applied that. When we are talking about a very particular group, medical students who are dealing in a specific situation. So our assessment has to be tailored towards that. So because they have to deal with patients, and they have to handle the emotional distress among the patients, and maybe in colleagues and their caregivers as well. So I think those general assessment tools may be useful generally, but in our situation specifically, when we want to see whether students can handle these situations, it would be better that we do it in clinics.
Thank you so much, sir, for your response. Sir, one last question. When we talk about integrating emotional intelligence into undergraduate programs,
Right.
in our integrated system, we are already teaching the topics like leadership, professionalism, conflict resolution, the topics you mentioned in your presentation.
Right.
So this means that we are somehow already integrated emotional intelligence into the curriculum. Because as a teacher, my study also proposed that we should include emotional intelligence in curriculum. But after listening your presentation and the topics you mentioned, these topics are already being taught in the medical students. So this means that we have somehow integrated emotional intelligence.
That's absolutely right, madam. Absolutely right. Actually, we are doing many things which are right, but we need to identify that we are doing these things, and once we identify them, then we can sort of regulate them. So some of the topics which I have mentioned, we might be teaching already. It's only now if we realize the real potential of these topics in training of our students, that would help us to organize these teachings in a better way. I'm sure many of these areas are already being taught in medical schools in one way or the other. But here the emphasis is that once we realize that why we are teaching these topics and how we can better organize them, that would be useful.
Thank you so much, sir.
Dr. Seran.
Namaste, sir. Can I ask myself?
Yes, please.
Yeah, Dr. Mehul Gosai, Professor and Head Pediatrics, Bhavnagar, City of Gujarat State, India.
Yes, sir.
Very nice presentation. My question is, various type of intelligence conducive environment, sir. And many a times we have seen that the environment of medical college or department at UG and PG level is not conducive, because different mindset people are working. So how we can overcome these obstacles?
You see, sir, the first thing I think all of us should realize that every one of us is intelligent in one way or the other. And then once we realize that, that can help us even choosing our profession. So we might have medical students who have different kind of intelligences. And if we realize that, we can extrapolate or exploit that kind of intelligence in their training. For example, those who are let's say, have spatial or visual, they are more easily trainable by showing them pictures, videos, charts, etc. So it's not only help us to identify the future professions, but also how we can help these students to learn. So basically what I am saying is that if we realize the importance of this, and then we see the potential in our students, and then we use that potential for training of those students, that would be the best use of this knowledge and this information.
Okay, thank you, sir.
Thank you.
Okay, thank you, sir.
Right, Dr. Seyran, please. Okay, Dr.
Hello.
Ahmed Mishwani, please.
Assalamu alaikum, sir. I am Dr. Anwar from Pakistan.
Yes, sir.
I would like to just commend that you have a wonderful presentation.
Thank
and
you.
the area of the emotions, which is a part of the personality, the expression of the emotions and controlling the emotions and expressing them at appropriate times. That is a part of the personality, and it is applied to all ages and all walks of life. So I think that we should convey to the authorities and the educationists that these programs should be inculcated from the school level, so that by the time the student comes to our setups, he or she will be having the baseline work done and baseline knowledge and all those attributes attained to a certain extent.
Sir, I agree with you, but if all of us start playing our role at our stage, then I think we can improve.
Yeah.
So to make a national change, we have to start from ourselves. So let's say if you have students and you obviously you know its importance and its usefulness, and you during your training you can inculcate this or include these things in your normal teaching. That can be that can be just part of your normal training without maybe using the word emotional intelligence. You can train your students accordingly. So if all of us start doing that, I think we can handle this situation.
Yes, sir. Thank you very much, sir.
Yeah. Dr. Ahmed Mishwani, please.
Assalamu alaikum, sir. Good morning to everybody. I am Dr. Ahmed Mishwani, Professor of Surgery from Peshawar, Pakistan.
Yes, sir.
Just a couple of comments or points. There was a question about the inclusion of psychologists in the faculty. Actually, this has already been included in the faculty of medical colleges, the clinical psychologist. The other question was regarding the assessment is already the three domains, the knowledge, skill, and the attitude are already included, and all are actually being assessed. And recently, in the recent past, the education and medical education, health profession education, culture has developed I think this 360-degree assessment or work-based assessment are all these are already but they have not been included fully in the curriculum.
Yes,
tools.
sir, that's the purpose of this presentation is that we might be doing it, but that may not be full-fledged.
Sir,
Please mute yourself. Please mute yourself, because we, as I said, that we are doing it to some extent in one way or the other. Just formalizing it and putting it in the right perspective may improve the outcome. Yeah, once we know the importance and we apply it properly, and not only simply apply, but we make it part of our assessment, a formal assessment. As I said, maybe in the form of a role play or simulated situations. I think that would be helpful.
Sir, I think this is the purpose of sharing the knowledge across, I think, the globe, and you are doing a wonderful job for this collaboration and pooling of the knowledge and experiences. And you are right, the people who are not practicing it, there may be few, but when all those joins, I think it will improve. And I think the uniformity and across the globe, the standard will be, I think, improved. With this, thank you very much, sir. It was a wonderful presentation and wonderful opportunity for all of us.
Thank you, sir. Actually, the one thing which I realized, especially when I was preparing this presentation and going through the literature, it actually is very, very helpful for our personal and professional life. Even if we are not aware and we start working on that, it would definitely help us in our personal and professional life to learn and apply this emotional intelligence. Right. Anybody has any other question?
Professor from definitely behavioral sciences and psychiatry is included from Pakistan Medical and Dental Council, and it's one of the mandatory to incorporate all these activities. So definitely all these programs would work particularly in context of mental illnesses. And we do provide a school mental health program as well, because all these activities would run in a better way if we trickle down in the teachers and students as well. And apart from this, we have also introduced WHO mental health gap program. So definitely we would cover all these areas like stress management, time management, particularly emotional intelligence. So today's lecture was one of the most important to be incorporated in our further daily activities, and that will enhance our skills, particularly the professional skills and intelligence skill, inshallah, in the future. These were my comments from your presentation. Thank you, sir.
Yeah, thank you, sir, for your comments and the sharing your experience. Here, basically, we are talking about the improvement of well-being. Our aim here is not as a treatment, but as improving the existing mental health and reducing the burnout. And I'm sure that would help. Is there any other question?
I'm Dr. Sir, again.
I am Professor Abdul Rashid Mian from Pakistan.
Thank you, sir.
My question is that how can we, to highly appreciated, sir. I have already listened your talks many times. This is the excellent. I just want to ask, can we integrate artificial intelligence and emotional intelligence to develop a better curriculum?
Sir, the emotional intelligence, I would say definitely yes. For artificial intelligence, I don't think I can give a comment confidently at this stage, because we are still learning, and there is a lot of debate in both on the pros and cons of artificial intelligence and how we are going to implement that. But as far as emotional intelligence, I'm quite positive, and I'm fully convinced that by training our students in emotional intelligence, we will be actually helping them a lot, and we will be producing better physicians and surgeons by taking this approach.
Thank you, sir. Thank you very much.
Thank you, Dr. Sher Alam. Once again, I want to make a comment. Initially, I had a question and you answered very well. I am Dr. Khaleek Ahmed, working as a head of the department in Karshi University from Lahore, Pakistan.
Yes, sir.
My comment will be that emotional intelligence, the tools, the procedures and the modalities. I think being a medical professional, we have had a Hippocratic oath right from the beginning after our graduation.
Right.
That we will make the confidentiality of the patient, we will make no harm to the patient. These are all included in this emotional intelligence. So I think it is a mindset. It is not needed to be trained. However, these abilities can be polished by giving these talks to our students and to our faculty members. I think this was my comment.
No, yes, you are right, sir. But the question here is that we have Hippocratic oath and we know all these things, but how well trained we are to practice these things.
Yeah.
I mean, you just take the simple example that you are a physician and patient is distressed, and that a patient starts crying in front of you. Now, how you are going to handle that situation?
Yeah.
So emotional intelligence is training in emotional intelligence is going to help us to handle these stressful situations. So definitely, as you said, we know the importance. Definitely, we know the importance, but whether we are trained enough to practice that or to apply that, that's the concern.
Okay, that's my concern. Thank you very much.
Right. Yes, sir. Any other question? Yes, sir. Dr. Abdul Sattar Khan, please.
Yeah, thank you very much, sir, for a wonderful presentation regarding the emotional questions and intelligence. I have two comments, and I need your opinion about that.
Right.
What is your opinion that if we are going to include the EQ, emotional quotient, some kind of inventory, and in the admission process of the medical students? So it will give an idea actually how much they are trained actually and how we are going to work for them to collect some kind of baseline data. And number two, that people are talking about the Hippocratic oaths and other things. I believe that we already incorporated or integrated the teaching of the emotional intelligence or the questions related to the hidden curriculum. If you're talking about the structures, maybe we don't have in many medical colleges, but all colleges are having a hidden curriculum which indirectly actually teaching all these skills to the students. And through the role modeling, by showing them how to pursue in this regards. So what is your opinion about these 2 points? Thank you so much.
Okay, sir. Now coming to your first question, actually that was interesting. I mentioned in one of the slide earlier as well that we admit the students in medical school based on their academic performance, and we do not know their level of, let's say, emotional intelligence, as you said. And then we see that some of our best graduates may not prove to be the best physicians. So the academic performance is not equivalent to, we can say that they can become the best physicians. Now, assessing the emotional intelligence or emotional quotient for admission if we are doing it to help the students, to identify the students who would need specific help after getting admission into the medical school, that would be justifiable. But to use this quotient to decide whether to admit in medical school or not, probably that would be debatable. So in a way, it would be good if we have this emotional quotient in our students and identify them that what kind of help they need. So I think that would be useful. Second, you said about the hidden curriculum. Obviously hidden curriculum is there, but problem is that it's not standardized. There is no way to see that how much it's being done or whether it's being done properly or not. So we cannot depend on hidden curriculum to achieve the desirable results. We must make an effort to achieve those results consciously. Hidden curriculum would always be there, but how can we say that everybody is doing it properly? So we need to organize it. We need to plan it properly to achieve the desired results. So that would be my take on that question. I hope I answered your question. Yes, any?
Thank you. Thank you so much.
Okay. Right. Any other question, please? If no more question, I would thank for your participation, and really I especially enjoyed the questions raised by the participants, and we learned from each other. I have learned many things from your side today, and I hope this webinar was of some help to you as well. So you can always send me the questions if you could not ask now, and if there are some afterthoughts, and I will try to answer as soon as possible. Thank you very much, everybody.